Stretching for Older Active Adults with Chris Costa and Gary Frenette. Hi, my name is Gary Frenette, and I'm here today with Chris Costa, and she's helped us put together an exercise routine for active older adults. Active older adults have their own set of challenges, and we thought that deserved a specific exercise and stretching video. One of the things that active older adults often struggle with is the risk of falls. And tell us how the stretches and the exercises that you've incorporated in this video can help in that regard.
Well, one of the reasons that people start as we get older, we lose some of our muscle strength in our legs, specifically inner thigh area. So the exercises that we put together in this video are going to help strengthen the legs, like the squats and the lunges. Also, we did sort of a beginner style with the chair, and then we graduated, if you wanted to standing. The chair just gives you more support and makes you feel more confident about the exercises. But what we will do is it will improve your strength in your lower body muscles, and in turn will help your balance and overall lifestyle movements.
So if someone's just watching this video for the first time, haven't really had an exercise routine, how should they start in terms of frequency and time that they devote to this?
Well, we would say definitely get an approval from your doctor, especially if you have any injuries or anything, but we would say start really slowly. Most people, as we age, we get very tight, and we need to start slowly and make sure that we don't injure ourselves. So we would say maybe do 1 to 2 times a week the first week, and then gradually go up from there. We do recommend at any age, no matter how old you are, that eventually you work up into most days of the week you're doing something physical. But we would say eventually 2 to 3 times a week would be about what you'd want to do the strength training exercises that are in this video.
And if you have access to a trainer like Chris, that would obviously be optimal. It's wonderful to have somebody actually watch you do the stretches and make sure you're doing them properly for the most benefit and the least risk of harm. But we've tried to very carefully go through the steps of the exercises and the stretches today so that you can do them properly and safely.
Absolutely.
So I want to thank you for your time, Chris, and we're excited to bring this video to our active older adults as a way to move and transition into a better sense of well-being and fitness.
Warm-up exercises, seated or standing. Upper body. Seated or standing, shrug your shoulders up and then push them down. Round your shoulders forward, then back. Raise your arms up and push up over your head, alternating arms. Raise your arms up to the sides and then back down. Do circles with your arms both directions. Take your neck side to side. These exercises help to warm up your shoulder and neck area before you start your strength training exercises. Do each warm up for about 15 to 30 seconds. Marching. Seated. Sit on the edge of the chair. March in place by lifting your knees toward your chest one at a time. Standing. March in place, lifting your knees towards your chest one at a time. To warm up upper body, move your arms while marching. To add more resistance and to elevate your heart rate, hold light weights in your hands while you're marching. Do this exercise for 30 to 60 seconds, increasing as your strength improves. Knee taps. Seated. Sit on the edge of the chair. Tap elbow to opposite knee, alternating legs. Standing. Bring your opposite elbow to your opposite knee, alternating legs. If holding weights in hands, bring knee up towards your hand and then alternate. Do this exercise for 30 to 60 seconds. Bicep curls. Seated. Holding weights in your hands, curl your weights up towards your body by bending at the elbow. Standing. Holding weights in your hands, curl the weights up towards your body by bending at the elbow. Start with 2 to 8 pound weights depending on your strength. Start with 2 sets of 10 and move up to 2 to 4 sets of 10 to 20 reps as your strength improves. Upright row. Seated. Sit on the edge of a chair. Hold the weights in front of you and lift up. Weights should be touching. Elbows will go higher than your shoulders. Standing. Hold the weights in front of you and lift the weights up. Weights should be touching. Elbows will go higher than your shoulders. Safety tip. Start out with no weights or very light weights to avoid hurting your neck. Start with a set of 10 to start and gradually work up from there as your strength improves. Back row. Seated. Holding weights in front of you, pull weights back and pinch your shoulder blades together. Standing. Holding weights in front of you, pull the weights back and pinch your shoulder blades together. Start with 3 to 5 pound weights depending on your strength. Start with 2 sets of 10 and gradually work up to 2 to 4 sets of 10 to 20 reps. Tricep pushback. Take your weights behind you with your palms facing towards the back. Make sure your shoulders are back and down. Push the weights back with your elbows locked. Don't swing the weights too far back, and make sure you are focusing on the tricep muscle, which is the muscle in the back of your upper arm. Squats, seated. Sit towards the edge of a chair. Stand up and sit back down. Standing. Sit way back as if you are sitting in a chair. You can hold your weights in your hands for more resistance. Safety tip. When doing this exercise standing, try and keep the knees from going past the feet. Start with a set of 10 and then move up in your sets as your strength increases. Plie squats, seated. Hold onto the back of the chair with both hands. Take your legs out as wide as you can, toes turned out. Squat straight down on the way up, tightening your butt muscles. Standing. Take your feet as wide as you can, toes turned out, and squat straight down. On the way up, tighten your butt muscles. Keep your weights in your hands for more resistance. Start with one set of 10 reps and increase as your strength improves. Lunge, seated. Hold the chair with your left hand. Step forward with your right foot bending both knees, then switch to the other side of the chair and step forward with your left foot. Standing. Step forward with your right foot bending both knees, then switch sides. Safety tips. Do not bend your knees too much at first. Start slowly with this exercise. A set of 10 on each leg is a good amount to start with, then work up from there. If you have knee issues, start with 5 reps on each leg and don't let the leg bend too low towards the floor. Neck stretch, seated. Sit on the edge of a chair. Take your hands behind you and clasp your hands together. Take your right ear toward your right shoulder, then switch sides. Standing. Take your hands behind you and clasp together. Take your right ear toward your right shoulder, then switch sides. Hold each side for 15 to 30 seconds to feel the stretch in the side of the neck and shoulder area. Shoulder stretch, seated. Take your left arm across the body with your elbow straight. With your right arm, pull the left arm in towards you, feeling the stretch in your left shoulder. Hold it for 15 to 30 seconds, then switch to the right arm. Standing. Take your left arm across the body with your elbow straight. With your right arm, pull the left arm in towards you, feeling the stretch in your left shoulder. Hold it for 15 to 30 seconds, then switch to the right arm. As you get more flexible, start holding the stretch longer to continue to see improvement. Torso and side stretch, seated. Sit on the edge of a chair. Take your arms overhead and clasp your hands together. Push your hands towards the ceiling to stretch your torso. Take your arms towards the right, then towards the left to stretch the sides of the body. Standing. Take your arms overhead and clasp your hands together. Push your hands towards the ceiling to stretch your torso. Take your arms towards the right, then towards the left to stretch the sides of the body. Hip stretch, seated. Sit on the edge of a chair. Bring your right foot to the left knee. Lean forward to feel the stretch in the right hip. Then switch to the left leg. Standing. Hold on to a chair or a door handle for balance. Bring your right foot to the left knee. Sit back into the stretch to feel a stretch in the right hip. Then switch to the left leg. Safety tip. If you have any knee problems, ease into it slowly to avoid any pain. Hold on each side for 15 to 30 seconds. Hamstring stretch, seated. Sit on the edge of a chair. Take your legs out in front of you with straight knees. Reach for the toes, feeling the stretch in the back of your upper legs, known as the hamstrings. Standing. Take your right foot slightly in front of the other. lifting the toes slightly. Bend at the waist to feel a stretch in the back of the right upper leg, known as the hamstrings. Then switch to the left leg. Safety tip: if you feel really tight when the knees are locked, bend the knees slightly. Hold this stretch for 15 to 30 seconds. Hamstring stretch, standing. Use a chair or a railing for support. Stand behind the chair or railing, walk your legs out, and with straight arms and legs, bend at the waist to stretch the back of your legs. Safety tip: if this is too hard for you, bend the knees slightly. Hold this stretch for 15 to 30 seconds. Upper and lower back stretch, standing. Use a chair or railing for support. Stand behind the chair or railing and round your shoulders up to stretch the upper back area, then arch the back slightly by pushing pelvis in towards the chair to stretch the lower back. Do a set of 10 to 20 depending on the flexibility of your back. Safety tip: arch just a little bit if you have any lower back problems.